Alrighty, everyone. Well, happy Tuesday, guys.
It is Happy Tuesday.
Happy Tuesday. Thank you so much for joining us. Sorry, we had a little bit of technical difficulties, but all good now. I'm here with Dr. Richards today.
Hello.
How are you,
Christine?
Doc?
Yep.
Good.
Doing well.
Today we are going to discuss all things dental implants. We're going to deep dive into what services our office provides. At any point, if you need any further clarification or you have some questions, there is a live chat. Feel free to type in your question and we'll get that answered for you. So
Now we like to talk, so we have slides where we can run through a slide presentation, but Christine and I love to talk.
We do.
I love to talk about what I do, and so feel free to come in with your questions, and we will be happy to explain. Otherwise, we're going to go through a slideshow that may be a little, more mundane and boring and all that kind of stuff. So we'd love to hear you, ask us questions so we can talk you through what we do.
Exactly, and definitely stick to the end because we do have some specials that we have currently going on right now. And also, if you would like to schedule a consultation or later on, maybe throughout the evening, you have questions that you would want further clarification, hop on the phone. You can call and speak to one of our team members, Lisa. The phone number is on the screen. So let's dive into it.
All right.
All right.
So I did a consultation today on a fella from, we're in Lakeland, Florida, and he's from Winter Haven, just a small town over to the east here. And he says, how long you been doing this? How many of these have you done? He's a builder, general contractor. And I said, well, I've been doing oral and maxillofacial surgery since July of 1980. But this specific procedure that we are talking about tonight, I've been doing since about 2000, 2001, something like that. The way we're doing it now with some improvements. Prior to that, starting in about 1985, we were doing fixed teeth. But, by today's standards, that would be kind of the old-fashioned way. So, been doing this 23, 24 years, and the process that we do now, we have perfected, or we feel that we have perfected it in order to allow our clients to have the best possible end result. So, please ask questions. That when you ask questions, you get the information that you want while you're on this webinar. We want you to get all the information that you want. Exactly.
And later on, we'll dive into how important it is that your surgeon should be a board-certified oral maxillofacial surgeon. So here we have on the screen, we have what a fixed upper hybrid looks like. Doc, do you want to talk about it?
Well, the hybrid is nothing more than a bridge. Some folks have a bridge attached to multiple teeth. This is a bridge that is attached to multiple implants. It is fixed. That means that it does not come in and out. It may be unscrewed and removed by us, but you do not take it out on a day-to-day basis. And it can be removed for cleaning once or twice a year. It's called a hybrid because it's sort of partially between a regular fixed bridge on teeth and it's a regular fixed bridge on implants is one of the differences. The other is that because a lot of people who have significant bone loss have the implants where the bone is and the teeth go where the teeth need to be, so it's kind of a hybrid of a bridge. And that's the typical name for this, a fixed, doesn't come out, upper is obvious, and hybrid.
Exactly. And with the upper hybrid at our practice, some offices, if you go to it, it might just be a set amount of maybe 4 implants, but something that sets us apart is that we actually offer 4 to 6 dental implants. The price is the same for the patient. This really gives our surgeons the autonomy to do what's best for the patient without having to focus about the cost of every single individual implant. So whenever you come in, some patients might need 4, and some, if you have the ability for for Dr. Richards, to
Yep.
place 5 to 6 dental implants, we will go ahead and do that without you having to pay the extra fee.
Yep. We don't, people aren't trying to hold us back. Doc, can't you do it this way? And can't you do it that way?
Exactly.
It just, not only that, we see a lot of people from all over the country. And when somebody calls in from South Dakota and we need to be able to give them a firm price on the phone, we can do that because it doesn't matter. It doesn't matter whether we do 4, 5, or 6 in the top and the bottom, what have you. So there are a lot of advantages to running your business model that way.
Exactly. And actually, speaking of all over the country, we see patients from all over 50 states.
Absolutely.
All over 50 states, and actually internationally as well. It's something that we're proud of, and we'll talk about later why we have so many patients traveling to see us.
I think we have a lower now, and once again, it's fixed. Doesn't come in and out. It's lower, that's obvious. And hybrid. Sometimes the implants are directly lined up with the teeth, and other times the implants are where the bone is, and the teeth go where the teeth need to go. So it's kind of a hybrid type of a bridge. They work very well. This is how it all started. When the Brandemark series of implants came over from Germany back about 1984, this is what it was all about, the lower. And over time, the upper came in, and zygomatic implants came in. We'll talk about that later. So there's been a lot of changes over the last 25 years.
A lot of changes. Well, if you're at the point of wondering what would a surgery day look like at new teeth now. So, actually before that, it looks like we have a great question, Doc. So Jackie wants to know, she is a smoker that has tried quitting to no avail. How would that work with her trying to come to us and have this procedure done? She currently has a top denture.
Yeah, I've done a lot of these procedures on smokers. That shouldn't be a problem. The European surgeons, smoking in Europe is a whole lot different than smoking here in this country. They do a lot of these procedures in Europe. I had a guy years ago, maybe 10, and when we were talking, he says, my favorite recreational activity is smoking. And he pulled his pants leg up, and in his socks, he had lined up like little bullets, cigarettes in his socks. This is true. And so he said, when I wake up enough, I want you to put me in a chair with my miniature Doberman, and I want to sit out at the back door and smoke until my teeth are ready.
Wow.
And we said, I think we can do that. So
Goodness.
I have done these procedures on a lot of smokers. Now, with that being said, if you're a smoker and you're a diabetic and you're on prednisone or you're on methotrexate for rheumatoid arthritis, the more things that you pile on, so-called comorbidities, then you can run into problems. So if smoking is your only thing, that shouldn't be a problem. If you smoke and you're a rheumatoid arthritic and you're on prednisone or methotrexate, then you're starting to pile things on and you could have a problem. But smoking alone doesn't bother me at all.
Yep. Thank you for answering that, Doc. We have a lot of great questions today. So Ginny would like to know that she currently does have one implant right now. Does that affect her having the procedure? And also with cadaver bone, can it be done without because she tends to spit it out? And how many days does she need to take off work from the procedure?
Having one implant does not influence it.
Nope.
That one implant may need to be removed. I can tell you that. If that one implant was placed for a tooth with a crown, that one implant may not be placed deep enough, and it's very common that we take those out. What was the second part
Cadaver
of that?
bone. Can it be done without cadaver bone? She typically spits it out.
Where we use, and you don't know, so I'm sorry I said that, but where we use cadaver bone is when I place an implant into what's left of a tooth socket. The implant is round and the tooth socket is oval. And so you put a round object into an oval hole and you're going to have a void. And so in a lot of cases, we will pack cadaver bone in those. If someone doesn't want cadaver bone, we draw blood from that person, spin it, and we get something called PRF, which is almost like a white gelatinous substance. And we pack that into these voids to help bone grow in that hole, in that void. And I think there was the last.
Yeah, there's that. And she also would like to know how many days she need to take off from after the procedure.
Well, I think if you stay with us and you kind of hear about the process, like if you're from out of town, then there would be some days before we could get you into a set of zirconia teeth to send you home. If you are local, then you could probably go back to work on the 3rd or 4th postoperative day, or sooner, depending on whether you have both jaws done or just one.
Yep. And then Jenny.
Hope that helps with that. Yeah.
Oh, and Jenny, no worries on the questions. Oh, you're local. You live in Valrico. Perfect.
Yeah,
That's perfect.
Yeah.
And then let's say that your question was, we choose shape and color. Is there someone who assists with choosing her shape?
Sure.
Absolutely.
In addition to Dr. Kirkpatrick and me, we're the surgeons, we have our own dentist. We have 3 dentists. And so after you would visit with one of the surgeons, before the procedure, you would have a visit with one of our dentists. And they would talk to you about tooth size, tooth shape, tooth color, and all that sort of aesthetic, or the bite or chewing and all that sort of stuff. So yes, we have a method to select that. Now, that being said, you're kind of getting down into the process of everyone on the day of the procedure is going to receive a set of printed teeth. And they go home in a set of 3D printed teeth. So then when the person comes back in 10 to 14 days, we all look at them. We all, meaning me, the laboratory head man, Terry, the restorative dentist who was visiting with the person earlier, and we look at the teeth. We also know that the person is going to have been looking at themselves in the mirror more than anybody. So the person who received the treatment is going to have ideas. I have ideas. Terry would have ideas. The restorative dentist would have ideas. And then we make changes. So if a person comes back and they've said, you know, my teeth need to be whiter, they need to be bigger, they need to be smaller, they need to be rounder, they need to be sharper, more square, you know, all of those things are changeable without any problem whatsoever.
Exactly.
Yeah.
And some of the pictures that you may see, or videos or commercials that you may see in terms of the shade, those are all the colors that our patients have selected. So that is fully up to you. You have the autonomy to choose what color of your teeth you'd like.
Make whatever changes.
And we'll talk about that in a later video.
Yeah, I think there's something about that.
Alrighty, well, let's move on to what a new teeth now surgery day will look like.
Why don't you do that?
Yeah, I got you, Doc. So you will arrive at about 7:30 in the morning with your driver. You're put under general anesthesia, under deep sleep. It's a pain-free procedure. It's similar to what you would have done at an outpatient hospital. And actually, our facility is built exactly like an outpatient hospital. We're actually ambulatory certified. And then if the patient has teeth, they're extracted, and then Dr. Richards will go ahead and place the implants. You're given antibiotics intravenously, and then while you're asleep, we'll actually make modifications to your teeth that we've already made for you to exactly where Dr. Richards has placed the implants during your time of surgery. You'll wake up, we bring you to a private recovery room. You are with one of our assistants the entire time to make sure that you are safe and comfortable, and our in-house lab will make the modification needed to your teeth. Then afterwards, your teeth will be placed in your mouth. They're adjusted, so you leave that day with implant retained teeth. They're temporary, but they do not come in or out. You cannot remove them. I don't think you'd want to take them out anyways, but they can only be removed if you are in our office.
So let me just make a comment which shows us all how old this slide is.
Yes.
Because number 4, while the patient is still asleep, we take impressions. We don't take impressions anymore.
No.
Starting about 2 or 3 years ago, everything went digital.
Mm-hmm.
And so we do digital impressions, we do digital bite registrations, we do digital everything. And it's quicker, it's more accurate, it reduces the time that you're asleep, it increases the accuracy of the fit. It's everything good in this regard for fabrication of the teeth. And we weren't doing printed teeth when all of this was originally done. So we've made changes. I can see we're going to talk about making changes in our slide.
We'll make some changes.
But we are almost as digital as you can get. Almost. We're right on the cusp of being as digital as you can get.
Yes.
Yeah.
We took a couple more modifications and we are there. Alrighty. And actually, speaking of innovative technology.
Of that, yep.
Perfect, Doc. Let's dive into it.
Well, you can read Micron. This is what's called a Micron mapper. It's a digital impression taker. It takes a full impression in less than 10 seconds. And this is the Micron mapper in action with Ashley. And it's aimed into the mouth. They're also looking at a computer screen. And as you see right here, it picks up all of these what are called scan bodies. And then later, things are scanned in a scanning fashion. So with the implementation of the Micron mapper for taking impressions and scanning everything for the bite registrations, it has allowed us to make more accurate teeth in a shorter period of time, less anesthesia time, everything good.
Yep.
So.
Exactly. Our office is always on top of our technology, and we're always looking for new research and how we can implement it into our workflow and to make it a better patient experience for you.
This is printing taking place. It's always kind of reminded me of that movie Predator. The dripping stuff off the teeth, you know. Or the Sigourney Weaver movie. Which one was that?
Oh gosh, which one was that? I don't.
The monsters with the stuff dripping off their teeth.
Oh gosh.
Alien, there you
yes.
go. So that last slide showed a set, we've kind of frozen up. Here you go. So this is a set of printed teeth. And those little chimneys that are sticking up, those interface with the implant abutment. And how accurate that this technique is, that we can have 6 interfaces all match up at the same time, so precise that little screws will go in through each one of those receptor sites. So this is so exact that you just have a hard time to understand unless you see it and work with it on a day-to-day basis, how precision these bridges are.
I know, it really leaves little room for error.
There is no room for error.
Perfect.
Yeah.
And then with the next slide, this is something that we feel that also sets us apart from other practices, is that everything's done in one day. It's all under one office. It's under one roof. We have our own surgeons on site. Our restorative doctors actually work on the 2nd floor of our facility. And then our dental lab is also on the 2nd floor. And we actually have a separate site that mills all of their zirconia teeth that are made for you. And this is super important because, you know, with other practices, when they're sending these cases off and when the lab is off-site, it could be in another state or another country. And sometimes things, you know, they don't come back as predicted. And so in this situation for those practices, the patient is typically left without teeth, you know, for however long that lab can get the teeth back to that dental practice. However, at our practice, our dental lab serves our patients only. And so you are a priority in our practice so that we'll never have to tell you that you'll be without teeth. So pretty cool, I'd say.
It's a good model.
It's a good model. We never have to disappoint our patients. And then we have 2 amazing locations to serve our patients. We have a practice in Lakeland, Florida, which is where we're at right now. And we also have a beautiful practice out in San Diego, California.
Dr. Sharafi.
Yes. And then these are our 4 amazing surgeons. We have Dr. Richards, of course, Dr. Kirkpatrick, Dr. Sharafi, and Dr. Evans. And again, they are all board certified oral maxillofacial surgeons. They have to go to dental school and then a rigorous residency afterwards, and then also pass their boards after.
And they're all a bunch of young boys.
Yes, bunch of
Except
youngs.
me.
Yes, yes. Dr. Richards is our mentor. He's the innovator. He's still young. He's young at heart. Perfect. Well, this is Jennifer. She is one of our patients. She was suffering bone loss prior, periodontal disease, and she was always putting off getting her dental work done. So let's hear her story.
What's going through my mind is that that's the old Jennifer right there and the old smile. Thank God I did something new. My name is Jennifer and I'm a real patient at New Teeth Now. I came to New Teeth Now because my teeth were just messed up and I had 90% bone loss. I had periodontal disease. It did accumulate over the years, but I also kept sweeping under the rug. I'll deal with it later. I'll deal with it later. And so it just caught up on me and I couldn't deal with it later. My jaw would hurt, my ears would tingle. It just hurt to eat. It is painful. It was a hot or cold stuff, was very sensitive, and my teeth would not stop bleeding. To the point I'm driving down the road to the dentist, spitting in a cup because I did not want to swallow it. And he was like, I can't help you here. You have to go see a specialist. So that's when I ended up at New Teeth Now. So I went in to see Harley Richards, board certified oral surgeon. He went to school for it. He knows. And I like how he gets excited about like new equipment he gets and stuff, and kept me at ease, talked me through all my steps. I got up early that morning and I was nervous. I could tell you I was nervous, but once I got in there and they put the little happy gas, let me go to bed, I woke up and I was fine. Holy cow. Oh my God. Oh,
They do look pretty nice.
ew.
Yeah, they look really.
I love them. Oh my God. That's $1 million smile right there. They did amazing. Amazing. They just feel good. Thanks to New Teeth Now, I can eat what I want. I feel good about myself. I can be comfortable in my own skin. I can smile. I can be healthy. I can do the things I want to do. It's a total booster. I smile more now. As before, I would just hide them. And now I'm just all smiles. Every time somebody looks at me, they're like, you just keep smiling. I'm like, I have so much to smile for. If you're on the fence on it, do it. You know, you won't regret it. You only live once, you know, and if it's an issue and it's concurring and it's been like this for years, you wasted all this money in this past couple of years. What is a little bit more to get it right? Just do it. You know, you won't regret it. It's the best decision I've ever made. Because that's $1 million smile right there. Nobody can take that away from me.
Perfect. And this is Jennifer after. She has so much to smile for. I mean,
Yeah,
Doc, look
it looks
at that.
good. Yeah,
Amazing job,
well,
Doc.
you know, the important thing is she's happy.
Yes, she's happy, she's healthy, and this is a story of what we hear from all of our patients after their procedure. And any of the patients that you hear doing their testimonials or on commercials, these patients were unpaid. They just wanted to share how we've changed their lives.
You know, you can't make everybody fully happy all the time. I've gotten old enough to where I understand that. And, you know, I also understand that it's not about what I think, it's about what the person thinks. And you got to get out that frame of mind and make, you know, everything you do to make that person happy. And I would say that that's what we do.
Yeah, we really do our best.
And the process that we have now, I think over the years that I have been doing this, I think that we certainly get the best final result for our clients. It takes a little bit longer to wrap up the entire process, but it really is good. And I would say that pretty much everybody is very happy, just like Jennifer, and has no regrets about what they've done. So, you know, it's pretty good, really.
It's really rewarding.
And if it
honestly.
wasn't, I wouldn't be doing it because I wouldn't need the aggravation.
Exactly.
So, but it's been very rewarding on our end for being able to help people
course.
who have lived, you know, with a mouthful of bad teeth for a number of years because of fear and anxiety. And so it's been very rewarding for all of us to be able to take folks, you know, if you're out there and you have a mouthful of bad teeth and you're scared out of your mind, we have people that can't even drive into the parking lot without breaking up into a sweat. And so, you know, if you're like that, we can help you.
Yeah, exactly.
That's all there is to it. You
Of
know, you
course.
just have to kind of suck it up and get the,
Yeah,
get
make
the nerve up to
yeah,
come in.
Pick up the phone and call us. Our team is so kind. There's no
So-
judgment, no judgment-free zone.
Yeah.
Oh, Jackie has a question for us, Doc. She wants to know, how about staining? And then, are the permanent teeth milled?
Staining. So, yes, they're milled. That's easy. The final even the temporary zirconia are milled, and the final zirconia, they're milled, and they have porcelain baked on to the zirconia frame, and it's glazed. Are they able to be stained? Sure, they can stain, absolutely. If you're a heavy, you know, like a cigar smoker, tea drinker, coffee drinker, or what have you, they can get stains, but they can be cleaned up. I don't think there's anything out there that can't be stained, that would be perfectly white, you know, 100% of the time, no matter what you do. So sure, things will stain, but it can be cleaned one way or the other. Good question.
Yes, very great question. So we'll jump on into our next slide. And so this is a traditional case that we see in our practice.
Right,
Pretty standard, right, Doc?
pretty standard, yep.
So we see this every day. Our surgeons, this is all that they do. So this is typically what we see in our practice. 6 implants on top. This particular patient, 6 implants on top.
Right, this would be
5
a
on the
traditional, what we would call a traditional tilted technique. And I don't know that I can move the cursor around on that, but if you look at the top, the far right and the far left implants are tilted to avoid the sinus, and then they have an abutment on the implant. You can see that junction between the abutment and the implant, and the implants are straight, like the you know, the 3 or 4 in the middle, and then the 2 on each end, or 1 on each end, has an angled abutment to straighten it up, and the same in the lower. So there's the implant down in the jawbone, there's the abutment that's attached to the implant, and then the teeth sit on the abutment. And this is probably 60%, I would say, of what we do, just a traditional tilted technique. Yep.
Yeah. And then moving on to the next slide, this is a zygomatic implant. This patient needed 2 zygomatic implants.
Right.
And we'll talk about zygomatic implants.
And so on the lower, it's a traditional tilted technique. There's a nerve that runs through the jaw. We have some short implants that we can use to avoid the nerve and some people's jaw. It looks real tall, but there'll be a concavity on the inside. So we have these short implants we can use. In the top, you can see those long implants, one on the far right and far left. And then there's traditional 4 in the front, and those are zygomatic implants. Zygoma is the cheekbone. So you have the mandible, which is the lower jaw, the maxilla, which is the upper jaw, and the zygoma, which is the cheekbone, forms part of the eye socket. And these zygomatic implants go from the jawbone to the cheekbone, and they're very useful, and we probably use those in about 20% of the uppers. It's variable. Sometimes when we look at the CT scan with the patient beforehand, I will look at that and I'll say, you know, I think you're going to need a zygomatic implant. Or I'll say, it doesn't look like you're going to need a zygomatic implant. And then when I actually do it, today, I did a upper, and I told the person they would need a zygomatic implant on their left, but I did not have to use a zygomatic implant. And so the CT scan gives us really good knowledge so we can fully inform our clients, but we don't always do everything we say we're going to do. But we use a lot of zygomatic implants. We are countrywide known as the zygomatic implant practice.
Yes, we place more zygomatic implants than anyone in the country, which is not a small feat to say. And then this is a diagram of what the zygomatic implants would look like in your skull. It's a little graphic, but at least it does explain exactly how it's done.
I think it's a fair representation
It's exactly.
of what it looks like.
Exactly.
You can see the most rear implants are at the tooth in front of the molar, which we like to get the rear implants at least at the tooth in front of the molar. Most hybrid upper bridges and hybrid lower bridges do not have that second molar. This is just a an illustration that we were able to obtain with copyright permission, of course. And it has second molars on it, but typically we don't provide second molars.
Yes. And then we have another question pop up, Doc. It's Jackie says that she knows wearing dentures, your gums will shrink. Will your gums shrink over time with these teeth? Can you do this procedure if you've been a denture wearer for 5 years or more?
Can we move to the X-ray that shows the quad zygoma?
Yeah, of course. Let me. Yep. There we are.
So this is a so-called quad zygoma technique. So this is the ultimate fix for wearing dentures and gums shrinking. Now, what you can understand is, I know that people say the gums shrink, but really it's the bone that shrinks over time, and the gums are a thin covering over the bone. So the gum tissue, there's two types of tissue. There's the mucosa tissue, Jackie, and the mucosa tissue is the thinner mobile tissue that's like inside of your cheeks. And then there's the gingiva tissue, which is kind of that thicker tissue that wraps around the teeth. And a lot of times when you've worn dentures and the bone shrinks, you lose all of that really good quality, thick gingiva tissue, and all you have left is mucosa tissue. And it's not ideal, but that's just the way it is. But the quad zygoma technique is a non-bone graft solution to having no bone. These zygomatic implants are very stable. They are the most sturdy, stable implants that we place. They are technique sensitive. However, my partner and I have both done probably over 2,500 of these each in the last, since 2007 probably. And we see very little problem with zygomatic implants. You can attach teeth to them the same day. And I think I said before, they do not require bone grafting.
Yeah, you did.
So it's a great technique. Before the zygomatic technique, it was all bone grafting, which was horrible. I don't even think about doing bone grafting because zygomatic implants are a simple office procedure, 2.5 hours. You end up with a set of teeth like we have shown earlier in this presentation, a fixed upper hybrid. Zygomatic implants are only for use in the upper jaw because they're in the zygoma, which is right at the upper jaw. You do not do lower jaw zygoma implants. It's only upper. And that's a rendition of what that looks like. Might be a little scary looking, but
Gets the job
That's
done.
what it gets the job
Gets
done.
the job done.
That's for sure.
Yes. Well, moving on. This is Dr. Richards' team. We're so lucky to have him, Doc.
Yep.
These are
Yep.
his.
Angie, Ashley, and Marylette. So a bunch of good gals.
Yes.
Helped me a lot. Couldn't do what I do without them.
Yes, exactly. Very knowledgeable.
And so we have a great team.
Yes. And then this is our restorative doctor team. And so these are 3 all amazing dentists. We have Dr. Nafala, Dr. Dibbs, and of course we have Dr. Perez, who is a prosthodontist. Let's hear from Dr. Dibbs.
My name's Elliot Dibbs. I am one of the restorative doctors at New Teeth Now. I've been here for a little over 12 years now. I guess one way to look at it is sort of the surgeons are creating the foundation with the implants, and the restorative doctors are building the house on the foundation. One of the things that really sets New Teeth Now apart from the other offices that are doing full mouth implant reconstruction is that I have my own laboratory here on site that myself and the other restorative doctors are able to use. And this is absolutely invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of this as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. And because of the emotional concerns that they have, we really have to spend the time with the patients. You cannot rush anything. I will show the patient the colors, I will review which ones are more natural looking or less natural looking, and the patient's going to make the decisions. They may want to change the aesthetics, they may not want to change the aesthetics, they may only want to change the color of the teeth. Whatever the case is, we're able to communicate that to the laboratory. I get emails daily from my designers that gives me a 3D design that I can review the new design and the changes that we made prior to the lab proceeding. So they're not going to move from my discussion with the patient and records gathering to a subsequent set of teeth without my approval of the design. It's something that's extraordinarily complicated that we just happen to make look pretty simple in most cases.
These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I just don't know of any other office that's like this.
Alrighty, well that's it from Dr. Dibbs. We're so lucky to have our restorative doctors to be a
We
part of
are.
our team.
That is the truth, for sure.
They handle, like our surgeons, Dr. Richards and Dr. Kirkpatrick handle everything surgical, and our restorative doctors really handle everything design, from the teeth, the appearance. They get to do it all. But yeah. And then coming up on this slide is something that's like super important. If this is really like one of the only things that you pick up from the webinar is really material. You should always, whether you're going to us or you're going for a second or maybe even a third opinion, and you should ask the question of what will my final teeth be made from? And this picture really depicts how important that question is. Right, Doc? Would you agree? Yeah.
I agree, yeah.
So on the top set of teeth are made from zirconia. The bottom set is made from an acrylic material, which is basically a plastic resin. And so both have been worn in the mouth for 5 years.
Right.
And you can clearly see the difference. Of course, with the zirconia, it's not really picking up any stain, while you can see that the acrylic set of teeth, which is on the bottom, has picked up stain. It is a bacteria trap due to it being a porous material, and it's not really meant to last the test of time. Ideally, if you take care of your prosthesis and your teeth, you come to your maintenance appointments, this should last you the duration of your lifetime. But with, of course, as with that being said, the material of your teeth should match how long the implants will last.
I would like to think that most people have gotten away from the old acrylic denture teeth.
You have to talk. It's kind of crazy, but there are some.
Oh, there really?
There are some offices out there that actually still offer acrylic material, and then if you want zirconia, they actually charge a fee for it.
We've gone totally away from handmade acrylic
Yes.
with denture teeth. And now we do printed teeth.
Yes.
So they're all one piece. It's very durable material. It's not made to be worn 5 years or anything like that, but the printed teeth are very durable. They're not porous
Yes.
like this old style denture acrylic with denture teeth embedded in it. That's way back.
Yes. and we offer printed teeth, and that's just your temporary material.
Yeah.
That's just your temporary
Yeah.
set, and you still get printed teeth. We don't do acrylic at all in our
Right.
office. Not even for temps.
You don't want that at all.
Exactly. So super important question. If you're going to any consult at any other practice, really make sure that you know the material of all your sets of teeth, especially the final set.
Doesn't Christine do a great job?
Oh, I try. Thank you, Doc.
Our
Trademark.
other young lady, if you have watched any of these before, our other young lady had her baby.
Yes, Bianca just popped out a little one. She's so cute. Yeah.
So we're all happy for her.
Yes,
for
she's on
sure.
maternity leave, so you get to stick with me well, just in these next few months. And then here are our implant coordinators.
Right.
We have Shauna, Chastity, and Allie. They're amazing. They will be who you'll be seeing when you're in our practice
Right.
for a consultation with Dr. Richards. They'll be your go-to. They'll answer all of your questions and your best point of contact. Unlike other offices, you have a direct line of for someone to speak to. You're not transferred from other people. You know, we really try to keep that line of communication consistent.
Well, and they are your first point of contact.
Yep, exactly.
And if you stay with us and you decide that you would like
Yes.
to do something with us, they lead you through the entire, every step of the process.
Exactly.
They are your contact person, so you do not get lost.
Yes.
You know, you have a personal contact that you know. So that's very nice having that.
Exactly. A lot of our
Yeah.
patients actually find like sometimes they don't even want to talk to, they really
Yeah.
only want to talk to their coordinators.
Yep.
So it's really great that we offer that. And then in terms of the consultation, when you come in to our practice, we take a scan on you, and at the end of your consultation, you will have a treatment plan with the exact cost of what your procedure
Right.
will look like. And then, of course, in our practice, it's really cool. Dr. Richards will actually sit down with you and he'll show you your CT scan. He'll actually measure what your bone levels are. And by the end of your treatment, your consultation, you actually know how many implants you'll get on the top and how many on the bottom.
Well, you know, I think what's happened is kind of funny is that Shauna has been with us for
Yes.
over 20 years, and she worked on the surgical side. And then Allie, who's been with us for maybe 10 years, and
Yes.
she worked over on the surgical
Yep.
side. And I don't think Chastity has as much experience over on the surgical side. She came from a general
Yes,
practitioner.
so she has heavy restorative.
So when I walk in to a consult that has been with Allie or Shauna, and I will start talking about various different things,
Yes.
and the person says, well, she already covered that, and she already covered that, and she already covered that. And so it's like, why am I here type situation. So what it has kind of boiled down to is I usually go through the CT scan in great detail, because the CT scan is a tool and it's an X-ray, but most people can see what's going on if we point out, and it has a great measuring tool, and we can show them everything on the CT scan, and I don't have to talk as much as I used to, because
Exactly.
Shauna and Allie and
Covered
Chastity,
it all.
they've already covered everything before I get in there, so they kind of take away some of the glory. But that's a good thing. The reason I mention that is all of these ladies are very knowledgeable, and not only during the consult, but if you have follow-up questions, you need to call back, they can answer almost everything.
Exactly. And then we actually had a question that popped up, Doc. Ginny wanted to know, can any foods be eaten after the final set of teeth are
Yes, any food can be eaten after the final, the implants are healed.
Yep.
Yes.
placed? Exactly. The world's your oyster.
I don't like you trying to take caps off beer bottles.
Yes, you can't do that. But basically the world's your
But
oyster.
any kind of food, hard, soft, pizza crust, anything,
Exactly.
you can eat that without having to worry about the teeth breaking or anything else.
Yep.
Yep.
Amazing. And then this is what our process will look like. And so if you're like wondering like, okay, if I move forward, what is a snapshot of the process?
Right.
So you'll start with a consultation, then we move on to an appointment called the pre-op and impressions appointment. Now, if you are out of state or you are not local, it is an option to combine your pre-op and impressions appointment into one appointment just to save you commute time as well. That is always an option.
And let me just add
Yes.
in that if you are from out of state, long ways away, then typically medical clearances, that's something we haven't talked
Yes.
about at
Oh, yeah.
all.
Yes, we haven't touched upon it.
But lab work, go ahead, Christine, move on through
Yeah.
this and let's come back and specifically talk about health,
Yeah, and we'll
anesthesia,
Yep.
and medical clearances.
perfect. Yeah, we'll dive back into
Okay.
that. So basically, you have your consultation. It's about an hour and a half. We move on to the pre-op and impressions appointment. Surgery day, you arrive at about 7:30 in the morning. You typically leave around 4 or 5 p.m. with your implant retained teeth placed. It's temporary. We have a couple post-ops that you have throughout your 6 months. Now, if you are out of state or you travel, we definitely can work around that. Any appointment that you are in our office, it is, of course, important. You know, we really respect your time as a patient, so we really have narrowed the amount of visits you have to come to us. But there are a few over the 6-month time frame. Then we go to your final teeth. Once Dr. Richards gives our restorative doctors a thumbs up, everything looks great, you're all healed to where you should be, then you start the process for your final teeth. Now, really, this process is up to, really, it's patient dependent on how long this process will last. A lot of our patients, you know, they're really happy and satisfied with their temporary teeth, so we typically take a scan and then they get their final teeth shortly after. Now, if you want to make changes or modifications, or you want to try something new, that's when, you know, that will add a few visits, depending on. So that part is really patient dependent. But after you're satisfied and you're truly happy with your teeth, then we will place your final teeth and you are done. That's pretty much it.
Yep.
And then, Doc, I know you wanted to jump back. So we wanted
Yeah.
to talk about like our health, the anesthesia aspect. So.
Something that we didn't cover is some of the health concerns.
Yes.
We're dealing with a population age group, typically probably older than 60. So, you know, I mean, who isn't on some medicines? Blood thinners, blood pressure, cholesterol drugs. Some people are on Ozempic for A1C, metformin, diabetes drugs, methotrexate, prednisone, the drugs for bone density. And so some of these drugs may influence the healing of the implants and others don't. But these GLP-1s, the Ozempics and that sort of thing have become very popular, and they slow the emptying of the stomach, and we have to stop those 2 or 3 weeks before the surgery.
Yep.
So, but all that being said, we have CRNAs, certified registered nurse anesthetists, who deliver our anesthesia, and these people are by the book. And so,
Very by the book.
yeah, most of them, they rotate in and out of our office, but they have jobs in hospitals doing anesthesia or other outpatient surgery facilities doing anesthesia. And so they're used to getting medical clearances, whether the medical clearance just from a primary care physician is enough, or if they need cardiology, pulmonology, endocrinology, or whatever other ology you got. We get a lot of medical
Yes.
clearances and blood work and cardiograms. And so no one gets through who has any sort of a health
Yes.
issue without a medical clearance for general anesthesia, because we are having our patients full-blown general anesthesia, just like in any other outpatient surgery facility, which is what our place is. It's like an outpatient surgery facility. So if you have health concerns, you don't have to worry, because that is the primary concern, okay? I mean, all this stuff about the teeth, that's all nice.
Yes.
But our primary concern is to move you through this process and keep you healthy. And if you have health issues, we may turn you down, or turn you down temporarily.
Yes.
Until something which is out of whack gets straightened out. So if some of you are out there watching and you have concerns about that, you don't need to worry about that, because we've got you covered.
Yes. And truly, as Dr. Richards says, we see patients with all kinds of medical issues. You know, we get referrals.
Heart transplants.
Yes, heart
I think Dr.
transplants.
K just did a guy with a heart transplant.
Yes. Yes.
So, you know, there are very few things that can't be overcome.
Yes, our surgeons and our team is equipped to handle basically most patients that are sickly, and we're very experienced, but we are stringent with the medical clearance aspect. All of our patients, especially Dr. Richards for 40 years, they've all waken up, afterwards, so that they can enjoy their teeth, and that is because we are very stringent on medical clearances and making sure that it's safe to put you under general anesthesia.
Right.
And it looks like we have a question that came up, Doc. How long do I have to be off ZEP-bound before surgery?
Off what?
ZEP-bound, Z-E-P-B-O-U.
What is that? What is that, Linda?
Let's see.
Is it a GLP-1? Is it
Linda,
a
do you mind?
bisphosphonate drug?
Yes. Linda, do you mind clarifying what medication you're on?
ZEP-bound, I am not familiar with.
Well,
most blood thinners, you come off of it a few days before. I take no medications and have no
Same as
medical
Wegovy.
diet. Do I still need a medical clearances?
ah,
Same as Wegovy. It's probably one of those things you need to be off. If it's one of those drugs that slows the emptying of the stomach for A1C, that sort of thing, then typically 2 weeks is sort of the standard from the American Society of Anesthesiology.
and then it looks like another question is, Ginny wants to know if she does not take any medications and doesn't have any medical history, does she still need a
And
medical
how old?
clearance? How
When
old
it's
are
60,
you, Ginny?
if you're 60, then if you have a primary care doctor, that would suffice. If you don't have if you're 60 years old and you have no history of cardiac problems, no history of pulmonary problems, you don't smoke, you don't take any medications, and we hook you up to our cardiogram and we take all of your vital signs and they're all normal, then you wouldn't need a medical clearance.
Perfect. Oh, Ginny's 61 years old, Doc.
Yeah, what I just said.
Perfect. Alrighty, and then moving on to the next slide, we have David. And so David was a patient of Dr. Richards. He always dreaded going to the dentist. He was always having to constantly do patchwork on all of his teeth, and it truly affected his day to day. Well, let's hear his story.
My name's David, and I'm a real patient at New Teeth Now. I associated going to the dentist with pain. No matter what I did, there was always a fix and then another problem. And it just got to a point where that's all I was doing, was chasing problems. That's when I knew I had to call New Teeth Now. Dr. Richards took the time to explain all the pros, the cons, and made you feel comfortable with everything. The days following surgery, I had very mild swelling. Pain was very minimal. Didn't even take the narcotics that was prescribed. I took Tylenol and ibuprofen. The greatest part is no more worries about what's going to happen to a tooth if I do this or I eat this. No more trips to the dentist. No more anxiety laying in a dentist chair. No more broken teeth while I'm traveling on the road. No more fear of how much is it going to hurt when they do this. Enjoying just life now. I don't have to be not in the conversation or keep my conversation short or wonder what I'm going to say and if I have to react with a laugh or a smile. I just get to be me. And that's the best part. My wife loves to take pictures anytime we're out on the bike, selfies together. Everything revolved around my smile. You would not think it would, but when you make this change, you realize how quickly that everything did revolve around whether or not you smiled or didn't smile or how much you enjoyed it. It affected your day-to-day. Now with that being fixed at New Teeth Now, it's gone. You don't have that day-to-day worry. You get to enjoy your life and do what you want. If anybody's worried if they should or should not, or if this is gonna work for them, do it. Pull the trigger, get it done, because when you come out of the other side of this, you're gonna wish you'd have done it sooner. The value is really, people try to quantify what they get for what they spend. There is no number you can put on this. It is the best decision I ever made in my entire life.
He says it's the best decision of his life. He's confident and enjoying life again without any worries.
Nice.
It's amazing.
Yeah, it's nice. He's a nice guy.
Yeah, he really is. So these are really the 3 key differentiators that we feel that we've mastered and also separates us from other practices. Number 1 being that all of our surgeons are board certified oral surgeons. It is a requirement we have at New Teeth Now, and it's so important, you know, whenever you're going to, that, you know, you're making sure that you're asking about the qualifications of your provider. You know, sometimes like things can be great if it's textbook, you know, but in the event that, you know, it doesn't happen according to plan and there's an emergency, you really want to make sure that you are in the hand of a provider that can handle it and is equipped to do so. Unfortunately, you know, there are a lot of courses that are popping up. They are weekend courses, you know, and you know, it teaches a provider how to do an implant or even a zygomatic implant, which is, you know, it's a little scary, Doc.
It's crazy.
I think it's scary. You know, I have a lot of friends that are dentists, and they think it's, you know, they also think that it's crazy too that there are these courses out there that's just a 2-day training course, you know, and you can do zygomatic implants after.
You don't want to get caught up in that.
Yes, you know, like zygomatic implants require so much technique and skill, and it's really in a spot or a part of your anatomy that most dentists will never see, and a lot of oral surgeons won't see either. We get referrals from amazing oral surgeons, you know, that are in the local area, you know, that they're great at what they do, but they're not comfortable.
They just don't do that.
They're not comfortable with zygomatic implants. So again, super important that you just make sure that you know the qualifications of your providers, and if they are placing zygomatic implants, how many zygomatic implants have they placed? Is it, you don't want to be that special, you know, surgery of the month, right? It's better just to be that, you know, it's what they do, it's their bread and butter, it's what they're experienced at. And then secondly, of course, zygomatic implants. As Dr. Richards mentioned earlier in the webinar, we place more zygomatic implants than anyone in the country. We are truly the industry leader in zygomatic implants. And then in general anesthesia. Some other practices, some offices may offer it at general anesthesia, but most will do it under IV sedation or an oral sedation, which is like a twilight sedation.
I think with respect to general anesthesia, if you have a CRNA that comes into the office, they cannot put a patient under general anesthesia unless the oral surgeon is also licensed to administer general anesthesia.
Exactly.
And so most all oral surgeons do enough general anesthesia in their residency training program that they are licensed in the state to administer general anesthesia. Therefore, a CRNA can work under that oral surgeon and provide general anesthesia. In my case, before I did my oral surgery residency in Jacksonville, I did a 1-year fellowship in general anesthesia. And so general anesthesia has always been a large part of oral surgeons' practices, and that's why all oral surgeons get a large dose of general anesthesia.
Yep. So really important. Those are the 3 things that really set us apart.
Yep.
And so do your
Absolutely.
research wherever you go. But these are probably the big three that you really should ask your second opinions and your third opinions. And Mark here says he needs to set up a visit with us. Yes, come meet us, Mark. We'd love to have you for a consult. Call Lisa. Lisa's number is right below on the screen. Give Lisa a call. She's on standby. She'd love to get you in with Dr. Richards to see how we can hopefully change your life. And then these are amazing resources that we have. We've worked hard to curate a couple of platforms so that you have someone to answer your questions. So we have our Facebook channel, our Instagram, we have our YouTube channel, which has all the past webinars that we've ever had, really great information on there. If you have any questions, it's really a great reference point to look at. We also have a TikTok as well. And then we do have our New Teeth Now community page. And with our New Teeth Now community page, it's compiled of all of our past and current patients. You can see what they're going through, and it's just a really great source of information. And then, of course, this is something we're super happy to announce. We have a lifetime warranty. These teeth are meant to last as long as you are upholding your maintenance visits. Your smile's forever. Now it's guaranteed for life. Now there is a lifetime warranty on the zirconia teeth and the titanium implants. This really reflects our commitment, and that we stand by our work. And it is the most comprehensive warranty that is offered in the implant dentistry world. And that's it. Do you have anything else to add, Dr.
No, I
Richards?
didn't. You do a great job.
Perfect.
You got to tell Aunt B.
Thank you, Dr. Richards. Well, thank you so much for spending time with us this entire webinar. If you have any questions or you'd like to schedule, give Lisa a call. The phone number is on the screen. Have a great day, everyone, and enjoy
night.
your
Yep.
evening. Stay safe.
See you later.